we can do so much better than this classic piriformis stretch. Let me show you how. So to really elevate that classic piriformis stretch, we first need to comprehend the action that the piriformis does, as well as the anatomy. Now, you might be familiar with both of these things, but how we're going to start to look at it might be a different approach. Let's start with the action. If you are asked what the piriformis is, what is your response? A lot of us say an external rotator. But if it's an external rotator, then why does that classic piriformis stretch usually bring us to 90 degrees of hip flexion and then externally rotate the leg to stretch the piriformis? Wouldn't you want internal rotation if it's an external rotator? The reason for this is that the muscle actually reorients. And as you approach 90 degrees of hip flexion, it turns into an hip internal rotator. Let me grab the pelvis so you can better understand. So the piriformis runs from the anterior aspect of the sacrum all around to the anterior aspect of the femur. Now we're going to talk about that in a second. But in this 0 degrees of hip flexion, like we just talked about, as that muscle contracts, it's going to externally rotate the femur. A lot of us are familiar with this. But as you approach 90 degrees of hip flexion, the muscle hasn't changed, but the line of pull has. Now, the piriformis is pretty much parallel. The origin and insertion are parallel. So as that muscle contracts, it still does it in the same way, but now it pulls it into internal rotation. So the reorientation or the line of pull change is what creates that internal rotation moment, hence why we then stretch it in external rotation. Now, let's stick on this sacrum and talk about the anatomy. So here we have the piriformis. I went ahead and hid some of the other muscles just so it's easier to see. I already mentioned that it's running from the anterior aspect of the sacrum to the greater trochanter of the femur. Now, when it comes to the classic piriformis stretch, in my opinion, there's overemphasis on this femur. We bring it into external rotation and it's really just held statically for 20 to 30 seconds. Well, at the end of the day, if we can have more an effect on the axial skeleton, we're going to better the appendicular skeleton. So in this scenario, if we can have more focus on the sacrum, we can have a better outcome on the femur. And the second thing is, when someone's dealing with a nagging piriformis, it usually limits their ability to rotate. So anything from walking, running, performing, that's going to start to cause pain, hence why they're probably in front of you in the first place. So to elevate a piriformis stretch, we want to start to add in rotation. How do we do that? All we need to do is start to focus on the sacrum and this part of the muscle. So what I want to do is to show you how we can start to move more dynamically and start to get this piriformis moving during rotation by elevating our classic piriformis stretch. Instead of laying on our back, like we often see with that classic piriformis stretch, instead we're going to grab a foam roller, but if this is too intense for your patient, you can grab a bench so they're a little bit higher. You can grab a plyo box so they're a little bit higher. In general, the principle is the lower towards the ground, the more intense it's going to be for your patient or client. However, the foam roller is great because it's cylindrical and it allows us to roll. And you'll see that we can then increase the intensity from the roll perspective. We're going to get to our example in one quick second. But before we do, I wanted to jump on here and make sure that you understand the movement that we need to do to move the sacrum further from the femur to stretch the piriformis. We want to think about shifting, and specifically, we want to shift the side that we are trying to stretch back. For example, if we want to stretch the left side, we are going to try to pull that left side back. What happens if we turn this around is as we do that, you'll notice that this posterior outlet here opens and expands. This is that piriformis going into that eccentric stretch here and opening and closing. That will be so much more functional for that person in front of you compared to just focusing on the femur. Here's the specific example. So the first step is to put one leg up on the foam roller and then always to cue your patient to bring the knee gently to the foam roller if they can get it there. This is a relatively vulnerable position for the knee, so I'm not really a huge fan of someone just forcing that knee down. So make sure they can truly own it by going in there. So this alone is going to stretch that piriformis because now we're in that classic 90 degrees of hip flexion and external rotation, aka stretching the piriformis. Now here's where the elevated part comes in. What we're going to focus on is, instead of just sitting here for 30 seconds, we're going to now focus on the pockets, left pocket, right pocket. Remember, we said that in our example, when we bring the pocket or the pelvis back on the side we're trying to stretch, it opens up. That posterior outlet expands, and the piriformis goes along for the ride. So in this example, the right side is up. What we're thinking about is drawing my left pocket forward and my right pocket back. And immediately, as I start to go into that, I feel an increase in the piriformis stretch. And so what we're doing is we are working on drawing that straight back like a piston. So that right pocket goes straight back, imagining it's a piston, and then we go in and out of it. So as I go back, it increases. As I come back on the left, it decreases. Now, from there, we can work on rolling the foam roller slightly forward. That's going to increase the piriformis stretch. Also, the amount of adduction of this left leg or the back leg is going to increase when it's adducted and decrease when it's abducted. So you see, now we have more control of the body. We are working this rotation aspect and getting that piriformis to understand how to elongate as we're rotating through that. Again, to me, this is a much more elevated way to stretch the piriformis dynamically compared to throwing someone on their back, having them pull their knee to their chest and hold it for 30 seconds.